Hello, and welcome to FedNetTV's Veterans Affairs Policy Show. I'm your host, Bob Carey. As the fiscal year is nearing a close, Congress had to pass yet another continuing resolution to keep the government funded because it wasn't able to pass even one of its 13 annual appropriations bills by the end of the fiscal year. How did we get here? Again. More importantly, what does this mean for our nation's veterans? And how can you protect yourself and secure the federal assistance you deserve from your service to the nation? We're going to address these and other topics with the legislatures and Congress on this episode of FedNet's Veterans Affairs Policy Show. So right now we're experiencing a pretty significant shortfall in the Department of Veterans Affairs budget. And in fact, in July of this year, the Department of Veterans Affairs came to Congress and said, sorry, we're $15 billion short. Now that was two parts. There was $3 billion of shortfall in the benefits, which is the disability benefits. It's like a paycheck for disabled veterans. And then there are $12 billion short in their ability to provide the health care for veterans. Now, this week, Congress passed a full continuing resolution for the entire U.S. government. Basically, it's a stopgap spending bill, and it's going to go until December to basically allow Congress to have more time to figure out how to get the appropriations done. But they also did pass a supplemental for that $3 billion of disability benefits to make sure that no disabled veteran missed out on their monthly disability check. But they didn't take any action on the $12 billion health care shortfall. And there was many questions raised on both sides of the aisle and within the Washington, D.C. community as to why this is happening. In a Senate Veterans Affairs Committee hearing last week, Undersecretary for Health at the VA, Sharif El-Nahal, had this to say about the department's funding shortfall.
At VA, we are on a mission to provide more care to more veterans than ever before. And since the historic expansion of benefits under the PACT Act, our commitment has been to enroll as many veterans as we can into VA care because we know it is the best and most affordable care for veterans. On March 5th, we made new groups of veterans eligible for VA health care years earlier than required by the law, including every veteran deployed to a post-9/11 mission, regardless of their condition or service connection. Any toxic exposed veteran exposed at home or abroad now also qualifies for direct enrollment.
I'm a little confused by all this because he's saying that we have a shortfall because they went faster than Congress asked them to go. Well, if my boss says, get this deployed in this amount of time, and I do it faster and we don't have the money for it, of course we're gonna have a shortfall. We need to explore this a little more, and hopefully later in this show we will be. Now that we've gotten a little background as to how we got here, it's time to talk to the legislators making these decisions in Congress. Stick around for that discussion right after these short messages. Welcome back to FedNet's Veterans Affairs Policy Show. I had a chance to sit down with Congressman John Cater on Capitol Hill to discuss funding concerns at the VA. Representative John Cater serves Texas' 31st District, affectionately known on Capitol Hill as Judge Carter. He is the chair of the House Appropriations, Military Construction, and Veterans Affairs Subcommittee, and also sits on the Appropriations Defense Subcommittee. We had a great discussion around the VA shortfalls, what his committee will do, and what needs to change at the VA. Take a listen.
We're going to be talking today about what has been a pretty remarkable incident of where the Department of Veterans Affairs came out in July and said, oops, we're about $15 billion short. Congress, can you help us out? And we really appreciate you coming and joining us today, Chairman, and get your aspect on this. I know that Senator Moran, they had a committee over at the Senate Veterans Affairs Committee, and he talked about what he saw as a lack of budgetary accountability and the lateness in which this issue rose. What are your thoughts? Do you think that there is, a legitimate reason why this happened? And if so, why was it so late in being reported to Congress?
We had already passed our appropriations bill out of the House, and it sent it over to the Senate. So, it was out of our hands. The Senate hadn't done anything, but they've got it, and we've got 6 other bills that have been sent over there. That's where we sit right now. But my first thought was somebody really dropped the ball on this. And after what happened last year when they accused us of underfunding the veterans, which was absolutely false, right around election time, I was a little taken back by another October surprise they were trying to create here at election time. But whatever it is, we've now got we've taken care of $3 billion of it. We've got a $12 billion shortfall. They've got a $140 billion fund that's funded in the VA, and we will probably do something about that. But first, I'm going to hold a hearing to get answers to the question: exactly why did this drop? Basically, for the House at the end of the appropriations process, we were finished.
Right. So, along those lines, I know that the House and Senate have passed their $3 billion for the Veterans Benefit Administration.
Correct.
To be able to provide the money for the unseen disability compensation benefits. And given how much total that is, it's probably less than 1% of a shortfall. And so I think people were sort of thinking, okay, that we can see, but the $12 billion, especially when the VA was saying that it was caused by the increased access to community care, and as I understand it, a veteran can only go to community care. I'm a VA patient. A veteran can only go
if they can't provide the care.
Right, if the VA can't provide the care.
That's exactly right.
So is that a reasonable reason why the $12 billion shortfall is that veterans are going to community care?
That's why we're going to have a hearing.
Gotcha.
That's why we're going to have a hearing, and I don't expect them to have a good answer to that question. I'll tell you, I agree with you exactly that way. If they did what they're supposed to do, then they're supposed to be able to be accountable for the funds that are going to the community health care. And they should be accountable to us. And if necessary, we can make them report every month. And that may happen because this kind of shortfall is a little too inconvenient in election year.
At the hearing at Senate Veterans Affairs Committee, Senator Bozeman raised the concern that when they were presenting their budget to the committee, they talked about how they wanted to reduce the amount of money they were spending in 2024 and 2025. And he was like, hold it, you're increasing the number of people that are coming into the VA healthcare system, yet you want to reduce the spending.
He's exactly right.
Are you concerned that there are other factors at play here of sort of trying to,
I think the younger generation that are coming into VA now is looking at the VA as an old antique, but with what we created, the ability, if they can't provide the service, they can go to another outside source. They find that to be a very good idea, and I'm sure that we are getting more people, which is what we want.
Right.
This is about taking care of our warriors. And if we can't take care of our warriors, which we promised them, then we're not doing our job.
Right.
And if they're not doing it, they're not doing their job.
I have heard folks say that the VA healthcare system is based around a 1970s model of critical inpatient care delivered from big VA hospitals, while the rest of the country has gone to chronic outpatient care delivered from strip malls. And in TRICARE with the Department of Defense, we sort of have that in terms of you go find your own provider. Do you think that there is a reasonable discussion to be had about whether or not the VA should be more built like the DoD TRICARE system?
I'm willing to talk about that. I saw the question that you had sent, and I thought, especially if you're going to build a hospital, building a hospital is a big cost. We built one on Fort Hood, now Fort Cavazos, and cooperation between the parties was very good. My counterpart was excellent, and we got that done. But it cost more than $1 billion for just that post.
With all the rural hospitals having problems keeping open and a lot of these rural hospitals having empty wings, it seems like maybe the VA should go in and rent one of those empty wings and then just use all the equipment at that rural hospital in order to be able to keep the rural hospital going, but also to be able to provide greater access for care for the rural veteran.
I'll tell you a quick story. When I was a freshman, actually I was a sophomore, I got on the Appropriations Committee, and there was a building in Falls County that had been a VA hospital. And I said, I'm going to go move shortfalls over there. It was closed. Yeah, well, the cost of renovating the asbestos was more than it was a nice building,
right,
but it was old and it
right.
had asbestos everywhere.
Oh, wow.
And so we couldn't use that. So there's a lot of things. We got 1 million buildings out there, but not all of them are usable.
Right, right.
We ought to get rid of them.
Which makes us wonder whatever happened to that Air Commission, the Asset Infrastructure Review that came out of Mission Act, and whether we should have had that or not.
I think we should seriously look at getting rid of some of the stuff that we own and nobody uses. But that's a different story.
At that hearing, Senator Sullivan raised some issues from the Office of the Inspector General, saying that, what did he say? I quote, the OIG staff routinely finds breakdowns and processes infrastructure, governance, leadership, and other failings that erode the foundations of the Statement of Accountability at the VA. How do we solve this? How does your committee solve this from an appropriations point of view? And how does HVAC solve this from an accountability point of view?
Well, the truth is, we could stand on their air hose,
Could stand on the what?
Stand on their air hose. They depend upon our funding.
Right.
And we can get very, very, make a lot of rules that require them to come in every day until it wears them out. And that could happen.
I was a deputy chief financial officer over in a previous administration over at the Department of Energy. And the fact that there may have been a $12 billion shortfall that I didn't know until 2 weeks before I reported it, I would have been fired if that had ever happened. And so I'm wondering, it's difficult for me to understand how this could happen at the VA.
Well, one of the things, the VA has a lot of tranches. Kind of every area does things a little differently. So if they mess up too bad, they just transfer them someplace else.
Right. As we saw at the Hampton VA and all the problems that the House Veterans Affairs Committee talked about in that hearing yesterday down there. And you find operating rooms at the Atlanta VA being closed because of fly infestation.
Oh, my Lord.
Or the Hampton VA and all the senior leadership being replaced because of improper. So what would you like to see come out of the hearing that you're going to have?
First off, I want them to explain exactly why they did not report the shortfall to us immediately. When they want something, they call me.
Right.
And I'm glad. I'm proud they communicate with me. But they didn't communicate that. They communicated it partially. But they should have communicated it fully. And why. And the why, I don't believe it's all from the outside care. I don't believe that.
No, in fact, in their 2024 budget request, 2025 budget request, they specifically said that community care was only increasing total costs about 0.7%.
Yeah.
So now to say that it's increasing it by these rapid numbers, it makes us wonder.
$1 billion is nothing to shade a stick at.
Right.
And
right.
$12 billion is, how do you lose $12 billion?
Right. Right.
That's the question that's got to be answered.
It's
not a county area.
Do you see an issue of basic appropriations issues of the VA? The VA is proud of the fact that they've brought so many new people into the VA healthcare system, and they've even talked about how they've accelerated access to that care from the PACT Act, the burn pit legislation. But it seems that you set up budgets for the burn pit legislation, for the PACT Act implementation, based upon a sequence of things happening, and for them to accelerate that, maybe going ahead of where the budget was, and so of course they're going to have the shortfall because they're doing it faster than you told them to do it.
And the burn pit is a terrible thing to make people do, but the soldiers and Marines have to burn the sewerage, and it's a bad policy of the Army and the military. That's ending now, I think.
Yeah.
But in Vietnam, that was a big deal. You did something wrong, you had to go burn them.
Right.
Burn a burn pit. It was a dumb thing to do. But then we did a lot of dumb things in the war.
Well, and also, at times you're thinking, we may die tomorrow anyway, so what do I have to worry about if I'm inhaling this stuff?
Yeah.
So,
who cares?
well, we really appreciate your time today, sir. We realize you have a busy day ahead of you, and but we really want to thank you for coming and joining us and doing this. Is there anything that you'd like to end on?
I'd like to end on the fact that, first and foremost, we have promised our warriors that they would have health care for life and good health care. That's my theory to operate my committee. I expect them to provide that. If it has to go off campus, it's going off campus. But it's important that we do keep that, and it's important that they are reporting accurately to the people who are having to provide the money. And finally, I don't like mandatory money. I think changing things to mandatory is taking it out of the hands of Congress and into automatic.
Are you going to consider possibly trying to change the toxic exposure trust fund and make it back as a discretionary rather than mandatory?
I would like to.
Well, that'd be a very interesting hearing. I'd love to. I would love to watch that hearing.
Well, I think mandatory. I think Ronald Reagan said mandatory is the policy closest to eternal life. It never goes away.
Or what was the other one? There's nothing so permanent as a temporary program.
Yes, that's right.
Yes, sir. Well, thank you very much, sir. I
you
really do
bet.
appreciate your time today. We look forward to talking to you more about this and to our viewers as well. And we really
Sure,
appreciate you
be
joining
glad
us.
to.
Capitol Hill has been in full swing trying to digest the $12 billion Veterans Health Administration supplemental budget request. The Senate Veterans Affairs Committee held a hearing September 18th to discuss just this. Senator Hirono of Hawaii asked the VA officials how they would best deliver that care.
So do you have a plan for distributing the healthcare capabilities to where the veterans are?
Yes, Senator, and one of the main drivers that compelled us to come to Congress to ask for $12 billion in additional funding was our ability to actually activate new clinical space in some of the fastest growing areas in the country that need a presence closer to them. On top of that, we have a lot more programming, Senator, that's growing significantly that brings our VA teams into veteran homes and communities. So we have home-based primary care. We have a lot more telehealth happening, 15% growth year over year. And we're really trying to, with programs like the Closer to Me program for cancer therapy, bring our complex cancer infusion teams closer to rural communities and veterans who live in more remote areas to bring that care closer to them.
What was interesting about that answer to Senator Hirono from Undersecretary Elnahal was that it was all about how they are going to build more, but building more hospitals and building more facilities takes years. How did this creep up on them? We need to figure that out. Senator Sullivan, a Marine Corps reservist from Alaska, quoted an Inspector General report about VA management.
They said, quote, the OIG staff routinely finds breakdowns in processes, infrastructure, governance, leadership, and other failings that erode the foundations of elements of accountability at the VA. These breakdowns impede the VA's efforts to make certain that patients receive timely, high-quality health care and that veterans and other eligible beneficiaries are afforded the compensation and services they are owed. Have you guys, any of you read this?
That is not pretty. That's a pretty long list of managerial failures on the part of VA, and really raises the question as who's running the ship over there. Senator Hassan of New Hampshire asked the VA how they would prevent this from happening again.
So what is the VA doing to ensure that it accurately projects the level of resources, including funding, that is necessary to provide health care for our veterans in the long term?
Thank you for the question, Senator. The main driver, as my colleague mentioned, for our need for additional funds is greater care delivery than ever before to more veterans than we anticipated, both enrolling and having their priority groups increased because of the hard work that VBA employees have done to grant more service connection. And so our efforts to improve our predictive models for our budget needs are going to take better into account three main factors. The first is our unprecedented outreach. Historically, VA has not necessarily been present in communities where veterans are at nearly the frequency where we are now. And I hope to be able to make sure that we project the result of that, which is more veterans finding out about their earned benefits and healthcare opportunities and enrolling with us. The second is the combined policy effects of the Mission Act, which has allowed more veterans to get care in the community to meet their needs across the country. And also the PACT Act, because of the dynamic I mentioned around priority group increases, which confer new healthcare opportunities to veterans in long-term care, dental care, and other services. Now, this, I think, was an underappreciated factor in our projections, and we will make sure that we take them into account into the future.
What's interesting about that is that Undersecretary Elnahal tells Senator Hassan, we had bad assumptions, so we're going to have better assumptions. But if they had bad assumptions the first time, how are they going to have better assumptions the second time? We're going to ask more of that. In fact, of our next guest, Darin Selnick, who's probably forgotten more about the VA than I'll ever learn. Darin was on multiple VA reform commissions, was senior policy advisor to the Secretary of Veterans Affairs, and ran the VA portfolio in the White House. He's now at Concerned Veterans for America, making sure that these issues don't go unanswered and that veterans' benefits are protected. Darin, thank you very much for joining us today.
Thanks, Bob. It's always a pleasure to talk to you about this stuff.
Thank you very much. So we showed a couple of clips earlier today, and we also had a discussion with Representative Carter, chair of the House Veterans Affairs and Military Construction Appropriations Subcommittee. And in some of those clips, there were some real questions being asked at the Senate Veterans Affairs Committee hearing last week regarding this shortfall, the $12 billion shortfall in VA Veterans Health Administration funding and the $3 billion shortfall in the Veterans Benefit Administration funding. And when this first came out in July, the VA had a briefing for many of the veteran organizations. And in that, they claimed that the shortfall was because of the expansion of community care. But as I understand the Mission Act, that I think that you were pretty closely involved in its drafting and its final passage, the VA and the VA regulations that executed them, it only allows the veteran to use community care when the VA can't provide timely direct care. So do you think that it's the community care issue that's causing this, or is it something else in the VA healthcare system or the VA system overall that's leading to these shortfalls?
Yeah, that's an excellent question, because there's a lot of propaganda that the VA has been putting out, but all you have to do is look at the VA's 2025 budget to get the real numbers. So I did that. And so I kind of framed this up, and I saw Sharif testify, and it's kind of like lies, damn lies, and statistics. So let's look at the actual numbers of it. In the projection models for 2025, the PACT Act, the expected increase in costs for VA healthcare based on the PACT Act is 0.4 of 1%. Mission Act is 0.04 of 1%. And so community care is if the veteran wants it, and if they're eligible, as the access standards is best medical interest, and those drivers are not going up. As a matter of fact, between 2021 and 2024, as reported in the VA budgets, there's actually 101,000 less veterans using VA healthcare. And when you look at the numbers in terms of the workload in the budget, you will see that in terms of global RVUs, which is a workforce number, the VA facilities are seeing less workload. Community care is seeing more. In terms of the actual numbers, in terms of outpatient and inpatient for actual appointments and everything, VA is expected to see less and community care more. So those are the real numbers. One of the reasons they have a deficit is because they were supposed to have 383,000 employees for VHA, but right now they have 418,000. And that's why $3.5 billion of the deficit is just extra employees they're not supposed to have in the first place. So these are some of the key numbers that raise the questions. What is really going on, and why is VA not telling the truth in terms of what's actually in the actual 2025 budget and the actual numbers versus the propaganda that they're putting on, which is a wish list of money to grow the organization, but not necessarily take care of veterans.
Wow. So, you know, we also played a clip earlier of Undersecretary Elna Hall in his testimony saying that a big part of the reason for the increase in the shortfall was that they had accelerated access to VA healthcare to pretty much all veterans, regardless of service-connected disability, and an accelerated schedule compared to that was being provided in the PACT Act, the burn pit legislation. So from my point of view, it makes me think that Congress made a schedule for the growth of the VA healthcare system and the admission of new veterans. And if the VA then takes it upon itself to accelerate that, and Congress has budgeted under the old schedule, you're gonna run out of money. Do I got that wrong?
Well, you have it right, except that's not exactly what's been happening. That's been part of the VA propaganda. So one of the frustrating things about the PACT Act was that it didn't actually give more veterans access to health care. They already could have done it. All it changed was the priority group. So priority group 6 versus priority group 3. And all you've actually seen is
and just so the viewers know, you know, the VA marks out the different levels of priority groups in veterans health care for who has the priority to get health care first, right?
Correct. So you had a lot of veterans, priority 6, which means you served, but you weren't hurt, which then, because of the PACT Act, you got moved to priority 1, 2, or 3 because of a presumptive that you may have been exposed to toxic chemicals. That didn't change the veteran, it didn't change their health care, it didn't change if they were sick. It just changed which group. And the only thing it actually changed was if they had to pay a copay. So on the VBA side, yes, you're going to have more cost if you just go ahead and paper push a lot through claims rather than actually properly doing them. And if you accelerate that, you're going to do it because you got to pay the veterans. If you do a claim and you say they have a disability rating because of their service and presumption, you got to pay it. The question, which I think was actually the question that I heard in the budget hearing, was, are you actually processing these properly, or are you just running them through? There's a big difference. That's number one. On the healthcare side, they went around marketing, telling everyone erroneously, sign up for VA healthcare, you may not get it again, but since 1996, you could have always signed up, and other things that have happened since then. So a lot of veterans signed up for it, but they're not using it. Matter of fact, VA's own projections, even with all these signups and everything, is that only 39,000 more veterans will actually use VA healthcare in 2025. You divide that between $12 extra billion, you're talking $300,000 per veteran. It's absolutely ridiculous. 39,000 would be a normal increase, which they already have the money for in their existing 2025 budget, which was a generous increase. Once again, it's a game they're playing in terms of community care. That's the only thing that's going up. They're asking for $1.8 billion for that. They're also asking for almost $2 billion for other contractual. No one knows what that is. Billions of dollars more for pharmacy, prosthetics, and all that was properly done in the 2025 budget. So what are they really spending the money on? No one really knows. That's why Congress is like asking a lot of questions and doing a lot of hearings.
So Senator Hassan of New Hampshire also asked, okay, so this happened. What are you going to do to make sure that this doesn't happen again? Undersecretary Elna Hall says, well, we had bad assumptions before, and we weren't as transparent as we needed to be. So we're going to have better assumptions, and we're going to be more transparent. Do you think it's going to be enough? If they had bad assumptions before, how can we ensure that their assumptions moving forward are going to be legitimate?
Well, I think in the original 2025, they actually had some good assumptions. And then they decided they wanted more money and more staff, so they decided to change the assumptions because they don't match. The system can't change in 3 or 4 months. What you're really going to need is outside investigation. You know, DOD had to do a big audit of this financially, and you need an outside agency, not just the VA OIG, which I don't have a lot of confidence. GAO, outside independent organization that audits the private sector, and go in there and find out what is really going on. and actually put in and tie things to their bonuses, quarterly reports. Senator Sullivan has some good legislation about if you can't do the budget right, then why are you getting bonuses? If you have a shortfall, are you getting bonuses? And doing quarterly reports, but you've got to go in there and get some expertise to really overhaul the entire way VHA does the budget. When I was in the VA, we had some of these problems. They didn't become shortfalls. We had some of these problems between the central office budget and the VHA budget. The whole thing is based on false premises, uh, false reasons. There is no actual proper accounting for how much staff you actually need. There's no fencing around it. So you need a total overhaul about what do you actually need, what do you actually get, and how do you do those assumptions, and what do you project to Congress. This has never happened before, these kinds of deficits, these kinds of shortfalls. It should never happen again, but you're going to need major reform and not broken promises from the Undersecretary of Health.
So in the hearing, Senator Sullivan of Alaska, also a Marine Corps reservist, he basically read from an Office of the Inspector General report that laid out a pretty condemnatory litany of managerial failures and lack of controls. So how would those, how would that outside review and outside evaluation help VA establish better managerial controls?
Well, look, you can't do this in the private sector. If you were to have a shortfall, you'd go out of business, and you certainly would be fired going forward. So what an outside organization do? One, it would show the fraud, waste, and abuse. It would show what you actually need to spend. It would show your lack of productivity and how you can increase it, and it would give Congress the expertise to sit there and go ahead and do the legislation to properly overhaul the VA and properly put in place the proper mechanisms. You could even probably go back to the Commission on Care report that touched on some of this as well, and some of the mechanisms in terms of supply chain. But we know the current process is broken. We need outside expertise, both government and industry, to say, how do you properly do this so that veterans get the care they need, get the proper funding, but we don't have an inefficient system. A good model is DoD, which is only $60 billion for the entire military healthcare system for 9.5 million patients, versus VA, which is $142 billion for 6.3 billion. So there's a lot of lessons learned from the DoD as well.
Which raises a very good point. There's I know that some people have talked about, why do we have two separate healthcare systems? We already have in Great Lakes Naval Station a combined DoD VA hospital. And you look at the TRICARE system, which is sort of the insurance program for the DoD healthcare system, and it operates like many other health insurance systems. Do you think that there should be greater integration with the DoD healthcare system? And what can VA learn from the DoD healthcare system that would help VA healthcare run more efficiently?
Well, a lot of things. You never hear horror stories about veterans not being able to get timely care in the VA, in the DoD healthcare system. That's because they've properly integrated. And so every veteran, when they go on Medicare, DoD has an integrated system, TRICARE for Life. And so you don't have to pay the copay on Medicare. It's a great program. VA could be emulating those sorts of things. If you're too far away from a VA facility, you can do TRICARE for Life, you can do TRICARE Select, and you can be much more efficient at how you run. DoD, for example, sees about 19 patients a day. VA is seeing about 6 patients a day these days. So there's just tremendous inefficiencies. And because of that, DoD has 144,000 employees to take care of 9.5 million veterans and active duty and family, while VA has 418,000 employees to see 6.3 million. So there's a lot of inefficiencies. And eventually, because veterans are so far and spread out away from the VA, you're going to see more private care. And that's what veterans are asking. That's why it's going up 16%, because that's how the big network. So there's lots of things you can do in terms of VA and DoD. I mean, why have two separate national networks? Why not have one national network, whether you're VA and DoD, that you can do? Why not follow DoD's example of secondary payer? Even in the Red Team report, which had a lot of bad recommendations, partial secondary payer would bring in $1.73 billion. So if you need to leverage the other health insurance, you need to integrate systems, and you need to actually be an efficient healthcare system. But the bottom line in all this is, you're going to provide veterans the benefit that they earn and deserve in their warfighting capacity in their service, then the dollar has to follow the veteran, and the veteran should be the person who chooses what's best for them, whether it's the VA or the private sector. And that's why we support bills such as Senator Blackburn's, Representative Stubbe, that would put the choice in the veteran, not in the bureaucrat.
Darin, you've been really generous with your time today. Really do appreciate it. As I said, you've forgotten more than I probably will ever learn about the VA system. One last question. I asked Judge Carter this, and I said, so should there be some rescissions to the VA budget in order to be able to fund the $12 billion in shortfall in health care? He said he's going to explore that at a committee hearing after the election. What do you think? Should, is there other places that VA could be, said, you don't need to spend that money. If you really need that $12 billion, take it from here and put it over there?
Well, first of all, I don't think they actually need $12 billion. I think they're just being very wasteful. So I think what Congress needs to do is do the due diligence, and it's going to take time to do an IG review or an outside review. But they need to go ahead and actually start proving what they need. They don't need all those extra employees. They said they want to go up to 405,000. They already had 418. So if they really want to go up to 405,000, they should be eliminating 13,000 employees. In the entire budget, the only thing that's actually going up is community care. They might be able to make a case for some of that 1.8 billion, but the rest of it, contract, they just say what they want. They expect Congress to do it. I don't think they need the 12 billion. I'd be surprised if they even needed any of that, because they already have a generous 2025 budget as it is. And yes, there are ways to do it. We went through this exercise in the Trump administration during the transition, and you can do that with OMB. There's lots of fraud, waste, and abuse. There's billion-dollar contracts just for consulting. There's contracts for IT that people have forgotten about. There's lots of money put off the books. So you need to do a real examination, deep dive examination of what is going on, where it's being spent, and VA should be coming up with, alternative ways of reducing costs, because we've gone through this exercise. They have gone through this exercise. There's many ways that they can reduce costs for next year, put off things they don't need, not spend things they don't need. I myself put up the kibosh on an $800 million proposal in 2019 for to hire 1,800 employees for a new nurse line that they had no idea whether it even be successful. So there's lots of things that can be done. VA needs to make a list. Appropriations and committees can make a list. But together, we need to tackle this, because we can't have this continuing problem.
Thank you very much, Darin. Darin Selnick, Concerned Veterans for America. I'm looking forward to having you on the show in the future, and thank you for joining us today.
My pleasure. Thanks for bringing this to everyone's attention.
Wow, that's a lot to digest. But my quick and dirty takeaway of what's important to remember is that the shortfall, the $3 billion shortfall in the benefits, that was probably legitimate and needed to be addressed. That's like a paycheck, and the veterans need that. But the healthcare shortfall raises a lot of questions, which I don't think the VA is yet adequately addressed, and Congress is going to hold off on acting until those are addressed. We need to watch this carefully to make sure veterans' benefits are not further threatened. So what can you do now to help on these issues? First, if you're watching this on social media, subscribe to the channel, smash that like button, and share this video with your friends. Second, call your senators and representatives at 202-224-3121 to make sure your voice is accurately represented in further VA budgetary legislation. Third, while you're on the phone with your congressional office, ask them about your disability claim. Ask them if they'll help you with the process, because it can be daunting. So ask them if they can assist you with this benefit that you have earned. You rate it, you deserve it, get it. FedNet will continue to help the American people become more connected to their representative bodies. I'm Bob Carey, and thank you for watching this episode of Veterans Affairs Policy Show. We'll see you next time.